Yes. So fractures, dislocations, and sprains. So get ready, take your notebooks. Right. Okay. So fractures, dislocations, and sprains. We are not going to do anything, not much activity. We'll be moving very fast because the text is already done. This is the first part. This is the first part. You can notice the first part. Yes. Now just to go through this and see bold letters, fractures, dislocations, and sprains. Okay. So these are different types. Write down the synonyms. My voice will be a little louder. Don't worry. It's like that only. Okay. So now write down the synonyms. Who will write down the synonyms this time? Whom can I trust that they will not miss anybody? Yes, Sanjana. Okay. You can write. You can type whatever I am telling, you can type in the chat box, all of you. So Sanjana, you can type. Then if Sanjana misses anything, there is another person needed. So who will type? Divya D'Souza. Okay. If you are ready to say, type, say yes, sir. Sanjana, you will type. Yeah, okay, sir. And Divya D'Souza, you also will type. Okay, so that nobody will miss anything. So only two people will be. If these two people miss anything, then others, anybody can type. What is already typed, don't type. First, Sanjana will type. If she misses anything, then Divya will type. Then if she also misses anything, then anybody can type. Right. But wait for some time. Okay. At least 30 seconds or okay. Then, because I'll be giving you a number of things. Right. So here, fine. So annotation, hide, yes, enable, no, yeah. So this is previous video is saved. Okay, right. So hide floating meeting controls. Okay, right. Write down synonyms, categories, types. Yeah, I want to ask you one question here. A quick answer from you all. You want the essence of finding answers in any reading task. So this is called generalization. Number two is you want to learn how to solve this particular reading task. This is called a specificity. So there are two things. So you want generalization or you want specificity. So generalization means, sir, we don't want to find answers in this, but we want ready to find, say one session we do, we will be ready to find answers in any session, sir. We don't need you, sir, again. Like that you want. Or, sir, only this answers you explain so that in every, okay, next time if we want, we will come to you again. Okay. So like that. That means every test you want me, or you want only this one once and afterwards you can do it on your own. I mean, so there is two things. Give me a fish. Okay, give me a fish. My master. Give me a fish, my master. Give me a fish, my master. I will live today. Give me a fish, my master. I will live today. Give me a fish, my master. I will live today. Or teach me fishing. Okay. Teach me fishing, my guide. I will live a lifetime. So today, one day I am teaching you fishing, and you can do every task every day. Or today I'll give you a fish. So I want you want to learn, you want a fish or you want fishing? A is fish. That means just finding answers. B is fishing. So now what do you want? What do you want? You want to fish or fishing? So that means A is fish, B is fishing, or A is a generalization. One unique lecture for everything. A is generalization. And B is specificity. That means only for this lecture. So now you decide on your own, because I'm going to give you the best if you leave it to me. Okay. So don't bother about time. I don't know when I'm going to stop and I am going to do. Because in the flow, I will teach many different things. Okay. So this is beyond boundaries type of lecture. Okay. Beyond boundaries type of lecture. That's it. So fine. Now many of you have said A. So let us see. Write down fractures, dislocation and sprain. So now here fractures, dislocation and sprain. Okay, you can write us. What's the name? Sanjana. You can write. Okay. Right, what you can write is fine. Haiti Republic. Okay. So reading day to evening batch. Okay. Fine. So categories, write down the synonyms. Types. Others you can write in your notes. Or afterwards you can collect from the Telegram channel, but write in the notes is better. Afterwards, who knows where you will find or not. Now is the time for you. Types, classes, kinds, categories, compartments, divisions. If you know any other words, you can type. Kinds, classes, categories, groups, denominations, divisions, areas. So like this, these are the different synonyms. Anything may be coming in the question. Anything of this word will come in, not just categories, anything. We don't know, he did not say categories. But of these words, anything will may come there. Anything may come there. So that is the point. Right. Next, number 2. So simple fractures of limbs. Simple fractures of limbs. Simple. You can use simple or you can use management. Because you see immediate management. Immediate management. Management. So write down management. Okay, write down the word simple. Right, next one, assessment. Write down the word assessment. Assessment means what? Write down the synonyms of assessment. Evaluation, observation, examination. Assessment, evaluation, observation, examination. So these are some words. Management, treatment. Management, treatment. Okay. Then management, treatment. Okay. Next one. Next one is again management. Examine, examine. See their assessment here. Examine. Write down the word examine. Observe, examine, notice, find, discover, evaluate. Verbs may come, nouns may come. Any word will be there. You have to be ready with these words. Okay. You have to be ready with these words. Next one. This also be management again. Management. And what is this management you see here? Okay. Management. Fracture or dislocation. Okay. We know that this is simple. You see here. It is simple fracture of limbs. Simple fracture of limbs. This is categories. This is management. Okay, clinical assessment means evaluation, observation. Right. Next one, management, examine, evaluate, observe, notice, find, discover, study, research. Anything may be there. Then next one, what are the words I am typing? Sanjana will type. If Sanjana doesn't type, Diwali will type. If they also don't type, you type. If even I did not tell any word and you identify, because you are all great people. Okay, you know many words. Don't think that Simon sir, what is telling is everything, because sometimes I miss some things, sir. If you realize that this word is also related to that one, you write, no problem, contribute. If you are telling, even before I tell some word, you get some word, you write. I appreciate. And after, I don't see what words you are typing there. So if really you have written that word, then you should be happy. But even before Simon sir has told, that means you have written, that means your mind is very powerful and it is dynamic and it is active. Be proud of yourself and type the word even before I tell. That is better. Others, you can type well in advance. For example, I did not tell the word. For example, if I say improve and you know the word enhance and I did not tell the word and you know it before, so type and send it. That means your work is like working like mercury. It is heating up. It is generating power. That is what we want. That is what I am trying to instill in you, create in you. Be careful. Do that. Okay. So this is management. Management means treatment, action plan, action, management, action, treatment, anything. Right. Now, third one, medication. So, drug therapy protocol, that is not there. So, we put a green label. Drug means medication. Using drug means therapy. Therapy means treatment again. So, drug is the most important word here. You can see. Drug is the most important word here. Okay. Next one. Right. Medication. Medication means what? Drug. Analgesia, medication, ointment, tablets, intravenous injections, syrup, all are drugs only. Okay. Names of drugs, generic names, okay, brand names, anything may come here. Okay. So all these are related to, yes, text C. And in text C, you see there is a table. In the table, again, you see drug. Name of the drug, morphine. And one ampule. And it is administered. Route. What type of route? Intravenous. Intramuscular. Okay. Oral. What are different things. Okay. Then here adult word is there. That means children also will be there. If adult is there, then definitely children is there. Why he is telling adult like that? Okay, right. So all these things are important. So this is medication. Right. Next one is D. D is back slap. So that one is simple management and this is serious management. Those are simple problems. These are serious problems. Those are ordinary things. These are extraordinary things. That is generally manageable. This is not generally manageable. That needs ordinary attention. This needs superficial attention. Super level attention. Specialist is needed for this. Okay. You are under special care for here. Because that is simple, no need special care. But here there is a lot of special care is needed. So now, this is back slab or plaster. Okay. Right. Arm fractures and leg fractures. Right, fine. So this is back slab. So that is simple and this is serious. So serious one is back slab. And if this is back slab, that is non-back slab. If that is simple, this is not simple. If that is ordinary, this is extraordinary. If this is back slab, that is non-back slab. If that is simple, this is serious. That's all. Anyone is the same. That is ordinary management. This is serious management. So try to understand this one. Right. That is it. So no need to read anything. Reading everything is nonsense. Don't read anything. Remember this. So now next, I have given you like these 4 levels. I have given you like these 4 levels. So this is the question will come here. We don't bother about the questions now. We won't bother about the questions now. Now question we'll see later. But this, so this 1 to 7 questions are like this. We'll take a recap before moving forward. Just fast recap. Most of you have written this. Take a fast recap. Write in your notebook. And when I ask you submit your answer, you submit your answer. And Sanjana will type. Question number 1. If I say Sanjana will type question number 1. Because only one person. Because I don't want to mess up with many things. I am focusing on concentrating, focus and attention. Your minds. I am trying to manipulate your minds. Make it dance according to my tunes, like a cobra dances according to the music of the snake charmer. Charm of the snake charmer. So like that, I am a snake charmer here and you are snakes now. You have to dance to my tunes. That's all. There is no other option. That's why I'm focusing on that area. So now here, first one, A is categories, B is management, C is medication, D is backslap. or A is types, B is treatment, C is drug, D is non-ordinary or extraordinary. A is classes, B is treatment, okay, simple. C is analgesia, D is any name you take, it is your game. It is your game. If you know what it is, that is enough. Any synonym you take and you apply, that's finished. Not just these things. Any name you can give. But you should know that all these words are related. Categories, types, classes, groups, divisions, departments. Okay. Classification. Okay. All these things, if you know, that's enough. Any one word you write, that's enough. Which is easy for you. All other things, okay. Management, treatment. Okay. Action. Simple. Okay. Next, medication, drug, analgesia, tablets. Medication, backslap, okay, not so simple, fractures, serious fractures, not ordinary, okay, dangerous, harmful, okay, problematic. Any word you can take, like that one. I have given you a number of words, okay, right. Now question will be there. So you have to keep in your mind. So you have to keep in your mind. This is mind game. This is mind game. Now I am showing you. These labels, sorry. Yes, these labels are not on your paper, or not in the question paper, or not on the table, or not in front of you, or not anywhere. They are in your mind. Keep them in your mind. Keep them in your mind. They are hidden. They are hidden in your mind. Only your mind knows what they are. Or write in the question paper, A, B, C, D, finished. Write in the question paper, not in the text booklet. Write in the question paper. Okay. Or else write in the question booklet only you write. Okay. Text booklet you write or question booklet you write. Wherever you write, no problem. But don't write in the answer area. Write in the question area. Side, left side or right side, in the margin or anything. Okay. Or if you worry, you can write in the text booklet. No problem. A, categories, B, management, C, medication, D, backslap. Directly your eye should go there. After every question, reading every question, your eye should go there. That's it. Okay. Now let us make a recap. Sanjana, be fast. So type question number 1. Question number 1. So now I am taking you to question number 1. Okay. Question number 1 is here. Procedures for delivering pain relief. Relief is given by what? Categories or management or medication or backslap. Come on, shoot the button. Answer, please. 3, 2, 1. Shoot your answer. Don't think too much. Pain relief. Something is given for pain relief. Procedures for delivering pain relief. Is it categories or management or medication or backslap? Procedures. Procedures for delivering pain relief. Okay, procedure. What do you mean by procedure? Procedure means what? Action, steps, measurement. Okay, plan. One by one you do. Flow chart, diagram, step-by-step action, activities. So delivering pain, what sort of activities are given? What exactly it is? Is it in categories? Categories, procedures for delivering pain relief will be in categories, or will be in management, or will it be in medication? Procedures, remember that. Procedures for delivering pain relief. Pain relief procedures together. Or is it in black slab? So you have hit the button. Very good. Now next we are going to, yes, first question. We'll see the answers afterwards. Write in your notebook, all of you. Afterwards you can check. Yeah. Right. Next one. Second one. So first question is done. Yes, second question. The procedure to follow when splinting a fractured limb. Splinting. This also procedure. Procedure means what? Is procedure categories? Is procedure medication? Is procedure management? Is procedure backslap? So you see procedures. 2 times question is coming. But first one procedure is different and this procedure is different. This is fractured limb, splinting a fractured limb. Splinting a fractured limb. And the previous one is procedures for delivering pain relief. Pain relief only. Okay. And the second one is the procedure to follow when splinting a fractured limb. Will it come in categories? Will it come in simple management? Will it come in medications? Or will it come in serious management? Or will it come in types? Or will it come in non-backslap? Or will it come in drugs? Or will it come in backslap? Now see what exactly it is. Yes, question number 2. Sanjana, write down question number 2. When I open question number 2, you have to write question number 2. Yes, shoot your answer. 3, 2, 1. Write in your notebook first before writing here, because you will check there only in your notebook. You cannot correct from the air. You correct from the air. So now you know splinting a fractured limb. Next one, third question. Sanjana, type third question. Number 3. Just write number 3. That's enough. Only number, only 3, 1 digit, enough. What to record when assessing a pain? Assessing a pain. Where did you get assessing? Categories, management, medication, backslap. Okay, 3, 2, 1, shoot your answer. Type and keep your answer ready. But when I say shoot your answer, then only you have to shoot your answer. All at a time. All at one time. So, assessment, evaluation, observation. Okay. This happens with the doctor. But backslap happens after the doctor. Okay. Doctor will assess and then send it to the person for backslap. So first one is anybody needs. Second one is before medication, before backslap. Then medication is after, okay, initial management. So management, initial management. Then backslap is after doctor's examination. So try to understand anything. So A is not at all related to the doctor. It is for everyone. I'm teaching you another style. B, management. Before coming to the hospital, management. After coming to the hospital, management. After, okay, management after the doctor says, observation. So, post-clinic, pre-clinic assessment. That means when accident happens, somebody will be giving some, manage some things. Then when you go to doctor, doctor will manage. After doctor manages, then he will go to some other place for management. So 3 types of management: pre, while, and post. Pre-doctor, while doctor, post-doctor. So 3 types of management are there. So remember that. Medication. Medication doctor will give. That is totally different area. So no problem. Back slab. Back slab is the last stage. After all these things, only back slab will be. Okay. So fine. So this is how you have to go. Next, 4th question. So 1 second. So question 1 is posted. 1 second. So question 2. Yeah. Question 2. Screen. Question 3. Yeah. Sorry for the delay. So question 4. So here you can see very clearly the terms, the labels, terms, labels, names, terms, labels, names, titles, terms, labels, names, titles, terms, labels, names, titles. So these are the words, terms, labels. Now types, classes, okay, like that, whatever it is. Now, is it going into categories, or is it going to management or medication or back slab? Question number 4. Yeah, 3, 2, 1. Hit the button. This is a revision. Hit the button. Your mind is activating. I already did this, sir, but still your mind is not ready to learn. Think. May start thinking like how I am thinking. Okay. I'm teaching you how to think. I'm not giving you the answer. I'm not mad to give you the answer. I'm not that one-day teacher. Every day I feed you. Every day I go fishing and give you food. I'm not mad. I'm not crazy. Okay, I'm wise enough. I'll teach you fishing. I say, go, live your life. Go anywhere in the world and live. I am not going to feed you every day. Right. Every day I have to teach you new things. Same thing every day. It's nonsense. So types. So finished. So next one, 5th one. Analgesia. Now 5th one is analgesia. What do you mean by analgesia? So question number 5. Yeah, 3, 2, 1. Hit the button. Hit the button. Write the answer in your notebook also, please. Write the answer in your notebook. To prove that you are active participant, you post this, take the photo of that one and post in the Telegram channel. Telegram, I'm going to make Telegram active nowadays. Okay. So there. Fine, next. Question number 6. Checking an injury. Checking an injury. So checking an injury. Question number 6, Sanjana. Yes. 3, 2, 1. Submit your response. What to look for when checking an injury? Checking an injury. Checking, observing, watching, managing, looking, finding, studying, discovering, evaluating, assessing. Where is it? With the doctor. Categories. No doctor is needed. Medication. After doctor checks only medication. Back slab. After doctor checks only medication. So checking is happening with whom? Try to understand. Is it with doctor or not? Who is assessing? Assessing means what? Checking means what? Evaluation means what? Observation means what? Examining means what? All are synonyms. Why doesn't your brain work like this? Okay? All right. Fine. Next. Question number 7. How fractures can be caused? Fractures can be caused. Causes of fracture. That means he is going to explain how these fractures caused. How many fractures are there? 1, 2, 3 or one only? Only one type of fractures? How fracture? Different fractures are caused in different ways. So different reasons will be there for different reasons. Causes means reasons. So different definitions will be there. Different means different. One is like this, one is like different means types. Okay. How fractures can be caused? Is that only one way to cause fracture? No, there are 3 different ways to cause 3 different types of fractures. Ordinary hurt, sprain, medium hurt. So what it is? So 3, 2, 1, hit the button. That's it. Thank you, Sanjana. 99 plus, very good. First time in so many years, I did not touch the chat box, and more than 100 messages are there. Wow, wonderful. Thank you. I appreciate. You have been a good assistant to me. Thank you. Right. Now, I'm going to give you the answers. Pick in your notebook. So now we are going to check the answers. Yeah, because this is important to go into the second step. This is very, very important. So now we understood where which types of questions are where. Then we'll go into deep. That is why he is giving you this. But there we already know everything. So automatically in these 7 questions, we know which text is related to what. So next question comes immediately. We jump there only. First part we are doing. We need not search everywhere. That's the point. This is reading test 1, yesterday's slide. Answer key, part A. Yes. Yeah. Yes, question number 1. Okay. Sanjana, type question number 1. So what you people do is, if it is right, type R and keep ready. If it is wrong, type X, means into wrong answer, and keep it ready. No problem. We are learning. No problem. Okay. So I'm going to first tick in your answer sheet, because afterwards you'll take a photo. Active students only I will give special sessions. You don't know, there are many other magic activities under my sleeve. Okay, I will select only those students to give extraordinary sessions. Okay, if you are not ready, yeah. Yes. Question number 1 is here. Number 1 is C. Number 1 is C. Tick in your answer sheet first. Then write. And write the submit the answer. If it is right, R. If it is wrong, into. Come on, fast. Then number 2 is D. Number 2 is D. Number 2 is D. Yes. Okay. 10 seconds. Yes, Sanjana, keep number 3. Question number 3. Number 3. Just number 3 you write. Okay, fine. Yes, here is the answer. Is B. Come on, hit. All of you hit. Be active. I'm going to see your result. With your names, I can see there. So that is why I'm going to help you. If you are not ready to provide, you are not active, then why should I be active? Am I mad to shout like this? I am a military commander. If it may shout only, your button should press and the bullet should go and the enemy should be killed. That's all. Every enemy is there. All the enemies are there in front of you. I'm killing all the enemies through you, shouting like this. Okay. Yes. Fine. Many students are not participating, but participate, please. Yeah. Sanjana, number 4. Type number 4. Type number 4. Yes. Right. Try to type your answer before Sanjana types the next question, please. Otherwise, it will be a mess of everything. Okay. Right. Now, next one. Question number 4. Answer is A. Answer is A. Answer is A. Yes. Very good. Very good. At least 10 people are typing. I will know why I'm asking you to type. You don't know. I'm not mad. I'm going to identify who is the best student and who is the mediocre student and who is the other type of student. You are only proving me indirectly through your participation. Okay. Right. Don't think that I'm not seeing all those things. I'm observing everything. Okay. Next, Sanjana, number 5. Yes. The answer is C. Answer is C. The answer is C. Yes, the answer is C. Next, Sanjana, number 6. Yes, here it is. Answer is B. Answer is B. Yes, the next question. Sanjana, number 7. Yes, the answer is A. Yes, finish it off. Now what you do is, now Sanjana, type total scores. Total scores. Total scores. We are doing fast now. Yesterday we did leisurely, so we were able to think, but I made you to think fast. I made you to think fast. You don't know. Okay, you don't know. I am playing the show. So I know what I am doing. Yes. Now, yes, submit your scores. Submit your scores. Pradnya 7, Surendra 7, Karuna 7, Rocky 7, Elizabeth 7, Renu 7, Greta 7, Sanjana 6. Neetu Mol. Sanjana, you were not present yesterday. That's why you got 6, I think. Neetu Mol. Okay, Uppala Sridhar 7, Rajni 7. Very good. Very good. Very good. Yes. Now what you do is take your picture and post it in the Telegram channel of your score. People will be understood. People will be surprised and shocked. Let them be shocked of what the actions you are doing, what the activities you are doing. Let them know. Okay, how serious we are. Yeah, here it is. This is the link for the, yes, anywhere you can go and type there. Okay, right. Anywhere you can type. Otherwise, I will type one thing there. What is that? You can type like this. Your score sheet. There, you can go there and click on, leave a comment, and it will open into a new box and you can post there. See, it will take you to discussion. here, your score sheet. I'm linking this one, copy, post a link. You just click on this one and it will take you directly there. It will directly take you to this point, your score sheet. And there, after going there, here, leave a comment. Yes, somebody, Uppula Srilata has posted. Yes, wow, that's it. This is what I want. So, you can open that discussion. Yes, Ajay Kumar, 5/7. Can you please post your paper like this, Ajay? I want paper like this, please. Karunas, Neharkar. Okay, your marks you are writing, but I want this photo of this paper. You can just put, yes, Reena, Raju, very good. These are obedient students, awesome students, obedient students, wonderful students, darlings of the teacher. Okay, teacher's pets. Whatever teacher is doing, telling they are doing like that. So, Ajay, I want you also to do like that. Karuna, I want you to do like that. Obedience, absolute obedience, unquestioning attitude, directly. Elsa, very good, Elsa, very good, wonderful. Yes. So come on. Post your sheets there because we are going to the next place. All of you submit your scores there. I'm teaching you new techniques there. Yeah, 5 people have written 5 different things. Yes. Okay. Submit your scores there. Now we are moving to the next questions afterwards. Once you're done, I'm giving you just 1 minute more. Afterwards, we are moving forward. Yes. Directly you will come here when you click on the link and you will open this comment section and there you will post the letter. There you will post your scores. Okay. Yes. Right. If you are not a member, then you can join this one. You can join this. Okay. You can become a member there. You can subscribe there to this channel because most active students will participate here. Right. Most active. 7th question I did not put on. Okay. I missed posting the 7th question. Yeah. Right. We are moving to the next round. 8 to 20 questions, 8 to 15 and 16 to 20. So height floating meeting. Yes. Question number 7. Yes, a new person has sent. Yeah, 2 more have sent. Raki has sent. Neetu, Arun has sent. These students will be given special sessions on Sunday. These students will be given special sessions on Sunday. The most active students will be given special sessions on Sunday. Selective students. The most obedient students will be getting the best sessions. Okay. Okay. Those sessions are okay. Yes. This is the best students list will be here from this generated from here. The best students list will be generated from here. So Rocky, Neetu, Elsa, Reno, okay, then Uppula Srilata. Karuna and Ajay, you also post the photo and just post them there. Yeah, very good. Remaining students also, you can do that one so that you can participate actively. Yes, see here. Fine. Yes, now we are moving to the next set of questions. Yeah, that's it. That's it. Fine. The pleasure is mine, not yours. You are happy, that happiness is mine. The pleasure is mine. Very good. So, right now, next one. Now, next questions, there will be 2 rounds. Round number 2. So, these are Okay, identification or relating the question with the passage. This is round 2. Round 2. Round 2. Okay. Round 2. Okay. Round 2. And what is this round 2 exactly? Let us see here. What is this round 2 exactly? Open question paper part A. Yeah. Part A question paper. Then file, open text booklet. Yeah. So both are opened. This is text booklet. Okay. And this is question booklet. Yeah. Only it's very easy now. No need to worry about much. No need to worry about much. Question number 8. These are information identification. So information identification, which text is in what? That is it. Okay. So 7 questions over. The next one is, you can see here, you have to write a short phrase, a word or a short phrase. That means short answer questions. Short answer questions. Short answer questions. You should not write full sentences. Short answer questions, SAQs. So the next type of questions are short answer questions. Or the other way, you can call SAQs. Short answer questions. Now this is a different type of strategy. So we are going to learn short answer questions now. Right. Short answer questions. Now, short answer questions, you can write one word or a phrase. There are 3 options here actually. You can write one word, one number, or a group of words, one word and a number. Anyway, you can write. This is round 2. That is short answer questions. Now I am teaching you short answer questions. How to go about with these short answer questions. Yeah. Fine. 7, 7. Okay. 8. Question number 8. These questions also in the same way you have to find out first. You should learn which area it is. Then only you will go there. Don't search every paragraph. It's again a nonsense. Instead of going directly to one text, you are searching in every text. Don't do that. Stop there near the question itself. Stop there near the question itself. So question is here. So now let us take the question here. Copy. Okay. Sorry. Yeah. I think this would be better. Yes. Now this is the question number 8. Now we are going to identify that one. Please don't rush. That is what I am asking you. Now, Sanjana, type question number 8. 8. Q8, that is enough. Q8. Because I am doing some other activity here. So Q8. Now in Q8, now what? Don't write anything. Don't write anything. Just listen to me. When I say shoot your answer, then only you have to write. Because I am taking you into 2 steps or 3 steps. You don't know that. So follow me. Otherwise, you will go and fall in a ditch somewhere. Don't be fast. Don't be slow. Right. Don't be fast. Don't be slow. Now here, what should be used to elevate? What is the word here? What should be used to elevate a patient's fractured leg? Patient's fractured leg. Yeah. That's the word there. And nobody else will type until I tell you, please. It's a warning. What should be used to elevate a patient's fractured leg? Let others also to think. United we stand. Sanjana, type this sentence. United we stand, comma, divided we fall. If you want to prove that you are great and you are first, that means you are making the other people helpless and you are not allowing them to think. Let them think. Okay, elevate. What should be used to elevate a patient's fractured leg? Now see here. What should be used to elevate a patient's fractured leg? So now try to understand, this is leg. Leg means lower limb. Lower limb. He may not say fractured leg. He will say lower limb, fractured lower limb. But the word is elevate. Elevate. Will this be in categories? Will this be in management? Will this be in medication? Or will this be in backslab? So elevating. Elevating is what? The word is related to what? Means doing something. Doing something. To elevate. To do. To do an action. So action is categories or management, simple, or medication, or backslap, serious. Now you think like this. Now, in which part it will go? Will it go into the text A, text B, text C, text D? Now like this. Yes, type your answer A, B, C, D and keep it ready. The same thing which we are doing for 1 to 7 questions. Same like that you have to do. Otherwise you are crazy. You are foolish. You are mad. Because you are not using skimming. That is what is skimming. This step is skimming. This step is skimming. Headings and subheadings is called skimming. Studying the heading and subheading is called skimming. Without doing skimming, don't go to scanning. You are not doing scanning, but you are searching. Searching those people do, those who do not know. For example, you want a knife, you will go and search. But if you know where the knife is, you will not search. You will directly go pick it up and bring it. That is it. A knowledgeable person and an ignorant person. A knowledgeable person doesn't search. Yes, he's a master brain. Yeah. A person, where is search? Where is knife? Where is knife? Where is knife? Simon sir is cutting the birthday cake. Where is knife? Where is knife? Just searching everywhere, standing there and searching everywhere, running every room. But what you have to do is stand there only, don't move an inch. Simon sir is asking you, get a knife, don't move an inch for a second. Close your eyes and you can see the knife where it is. It is in the stand, which is fixed to the wall in the kitchen. It is dancing in front of you. Yes. Go there, bring it up. Don't run madly like an ignorant person everywhere, open every room and search. No. That's it. The next question is, where is kitchen? That's all. Like that it should be. So every room, one room is bedroom here, categories is bedroom, management is hall, medication is living room, back slab is dining hall. And the question is knife. Okay, the question is knife. Only the question is knife. Okay. And you go there and you bring it and you'll cut the cake. You'll go to that particular area and take that knife and go to cut the apple. So the apple is there and you'll take one slice, that is one word or one sentence, and you write in there, fill in the blank. I'm not teaching nonsense. This is called known to unknown theory. You know how to cut a cake, you know how to cut an apple, but you don't know how to cut the answer out of the sentence in the passage, in the text of the passage or the task. You don't know how to slice the answer, take it out from the sentence of the text of the task. That's it. You don't know this, but you know how to cut a cake. You know how to cut an apple. So I'm teaching you the example of apple or cutting a cake to teach you how to cut the question. Yes, easy to difficult. That is easy for you. This is difficult. That is known for you. This is unknown for you. That is simple for you. This is difficult for you. That is simple. This is complex. Known to unknown. Write down, Sanjana, known to unknown. Easy to difficult. Simple to complex. General to specific. Cutting is general. Cutting the sentence is specific here. Easy to difficult. Known to unknown. Simple to complex. Easy to difficult. These are called orientation of identifying information. Elevating, you know, because it is in the question. Where it is, you don't know. Elevating, see the before, word before. To elevate means to do an action. Action means what? It's a step. Step for what? Step in a procedure. Procedure what? Is it management or backslash? Think like that. Now you will go there too. Right. So, 3, 2, 1, submit the answer. 3, 2, 1, submit the answer. What answer? A or B or C or D? A or B or C or D? Submit the answer. Yes. I will not show you. I'll show you afterwards. Right. We'll take only the majority vote. Sanjana? Okay. Count. Which is the majority, please? Which is the majority? Yes. Now, which is the majority vote? Take that one. We'll take that one only. If that misses, then we'll go to the next second best. Second best. Sanjana wrote B. Yes. Now we'll go to B. We'll go to B. What should be used to elevate a patient's fractured leg? Okay. Right. Now we are moving to B. Yes, majority vote. That's it. Majority vote. Yeah. Now here we are going to B. Yes. Now here and in B, there are 4 different areas. In B, there are 4 divisions. So we have seen this. This is text A. This is text B. Text C, text B. Text B. So this text B. So now you have to see, right. Now where will you find in simple fracture of limbs immediate management or clinical assessment or examination or after examination management? Now where will we find? So now here again 4 parts. I'm going to give you 4 parts. In that one there are 4 parts. This question has 4 different areas. In text B, we went to text B. Just bear with me because I'm doing a lot of things. So text B has again, we know that it is text B. Yes, we know that it is text B. In text B, again, so we have decided that it is text B. Yeah. So, see, control B, text B. We decided that it is text B. Okay. Yeah. We decided that it is text B. Fine. That is it. Okay. We decided that it is text B. That's fine. Here we'll put. Okay. Now in the text B, we have 4 different things. First one is immediate management. So there are again subheadings there. Immediate management. So management we know immediately. Okay. Immediate management is the first one. So immediate management is the first one. Then next one is, yeah. So text B, simple fracture of limbs, immediate management. Here it is there. Immediate management. That means when somebody falls down, immediately somebody takes the action. That is immediate management. On the spot of the incident or accident. Then next one is, he comes to the clinic, then clinical assessment. So clinical. So that means doctor is taking something here. Clinical. Then next one, this is clinical assessment. Clinical assessment. Okay. Then next one is examination. Just assessing one, then examining. Examination. Okay. So this is in the clinic. Okay, fine. Next one is this one, management. So this is immediate means preclinical. Preclinical. I'm giving you different styles. Immediate or preclinical. Preclinical or immediate. So that is it. Preclinical or immediate. So that is it. So you understood what is preclinical. Next one is, this is assessment by a doctor or a specialist. So this is clinical. Okay, assessment. Clinical assessment, just assessment. Just assessing according to his words, according to his explanation. This is clinical assessment, just talking. Then this is general assessment, clinical assessment. This is physical examination. This is physical examination, you understand now. So why he changed the labels? Next, last one is management. This is post. Okay, after everything, this is the last stage. Final stage. So first, second and third are clinical. Okay. Second and third are clinical. First one is immediate. Last one is final. So elevating the fractured leg is before assessment and examination, or after assessing and examination, or while assessing and examination. Sanjana, type there. Pre, while, post. Pre-examination, while examination, post-examination. Pre-examination, while examination, post-examination. And now here, while examination is divided into two parts. Okay, oral examination, asking questions, and physical examination by using hands and gloves, and fingers, and prongs, and some metal things to test the numbness and pain. That is physical. And B is non-physical examination. C is physical examination. That's it. So now I think you understood there. Yes. Now let us see here. So second will be going into 4 parts of text B. We know that it is text B. We know that it is text B. Yes. We know that it is text B. Now, if it is text B, okay, if it is text B, okay, this did not come, now it will come, yeah, yes, the second stage is, we know that it is text B. Now, text B, this, to do this action, when we will do before meeting the doctor, or when he is with the doctor, or after leaving the doctor. So he is with the doctor that time, or before the doctor, or after the doctor. So you have to understand, this elevation of the leg happens when? Before coming to the hospital, or after coming to the hospital with the doctor. And in the 2 stages, that is oral examination, asking questions and finding out information, what happened, where is the pain, is it in hands or legs or head or back or front, all these things. Then only he will go physical examination. First he will tell, where is the pain? He will tell leg. Then only he will go put his hand there and check the leg. So try to understand that one. So first he will ask, then he will go there and he will check. So this is the way how you are going to do. Now, there are 4 different things now. There are 4 components now. So in these 4 components, this is level 2 question. So from all the passage, from the question you went to the 4 different parts and 1 part you went. Then within the part there are again 4 subheadings. So which area you have to find out there. So that subheadings also are important. So now, yes. Now shoot your answer, A, B, C or D. All of you shoot your answer. Where is your answer? A, B, C or D? Is it before coming to the hospital? Or after coming to the hospital, oral interview? Then C, physical examination? And D, after examination, he is sent to the ward and he is given rest or whatever it is until operation or something happens. So when is this elevation? Okay. So that is, you hit the button. Now Sanjana, check which is the majority option. Yes. So which is the majority option? Just check. So Sanjana says D, because you are monitoring all those things. I cannot monitor behind the screen. Okay. So D is the final one. So now, very good. D is the final one. We got it. Yeah. Now I'm taking you again to D. There, what are you supposed to find? I will tell you. Right. So this is the second stage you got, and second stage you got the option D. Okay. Now, while going to the second stage, what are the things that you have to notice here? What should be used? What should be used? This is the point. What should be used? What? What leg? What for leg? These are the related words. So you have to go to leg. These are the two important. Patient is there, fracture is there everywhere, used is there, should is there, everything. All others are nonsense. Elevate, leg, what? Needed. Other words are nonsense. Other words are nonsense. Elevate, we already know. Now, after going there, you will see leg. Leg is the next word. Leg you will find there because leg is there. This leg will help you the answer. There near the leg, you will get the answer. Forearms, four limbs, hind limbs. Okay. Upper limbs, lower limbs. He can give anything. Don't think that he will give the word leg. He is not crazy. He is OET. He is very powerful. He will try to fool you. He will try to trick you, to test you how strong you are. Okay. If you are the strongest, you will get 500 score. So go there. Okay. To the word elevate. And there you will find left leg, right hand, left leg, right leg, whatever it is. Upper limbs, lower limbs, four limbs, hind limbs, whatever it is. He may use the same thing, hands and legs also. Whatever his wish. So there you go, find the word elevate. There you go, another word leg. Then you will see what is important. Another important will be there. One word only will be there, important word. A new word. That word you have to take. Now I am taking you there. So this is how you have to identify. Okay. Yes. You are going to identify these two words. The other people who are watching in the Telegram channel or somewhere else, they will not know what I am showing you here. Okay. Now see here. This is first immediate management. So here it is not there. Clinical assessment, it will not be there. Examination, it will not be there. Because doctor will not do this. Nurse will do. First one is for everyone. Second one is for doctor. Third one is for doctor. Fourth one is for nurse or some other sub-staff. Assistant to doctors. So fourth one, there only you will get. That is management. Post-observation, post-checking, post-assessment. Here you see where it is. You see here. Okay. Here you see the word. Use the word elevate. Where is elevate? Where is the word elevate? How do you find the word elevate? You will find out that one. There you see elevate the limb. Elevate the limb, upper limb and lower limb. dash for a dash and dash for a dash. They will be separated by comma or hyphen. You can see there. There will be parts. Now I am pointing it out. So, how do you go to that particular point? These will help you. So, first one is first one is right. First one is splint. These are the words. Splint is the first word. And second word is elevate. First word will be the heading of this set. This sentence also has a heading, elevate. And this is treat. Because if is there. If is there, so it is not the beginning of the sentence. If is there in the beginning, it is not in the beginning of the sentence. Despite, in spite of, if, as, since. If such words are there, conjunctions are there, that means it is not the beginning of the sentence. And therefore, the other part is the subject of the sentence and verb will be there. Treat means you treat. Administer. Consider. And X-ray. So these are the words, important words. So elevate is the key word here. This elevate the limb, this is the common style. Then here there are two things separated with a comma here and with a comma here. Before a comma and here before. Here is a hyphen and here is a comma. First one for first, second one for second. So now you know the answer. I have kept it in front of you. Now type and keep your answer in your, write and keep your answer in your notebook. And type and keep your answer here. Yes, I will be counting 7. Type and keep it ready. All of you should hit at a time. 6, 5, 4, 3, 2, 1. Submit. Submit all of you. Active, passive. I don't want any lazy people. Active people, you are already spending a lot of time. Be active. Let me see that you are active. Let me see your names there. 15 students have typed there. That means still 2 or 3 did not. Okay, fine. No problem. I am there among that. So, right. Now here, I am going to check your answers. All right. Ajay, no, Divya D'Souza. Why do you think you need to write all capital letters? There is no need to write all capital letters. And pillow, is it countable or uncountable? Okay, if it is countable, then you have to write either singular or plural. Pillow will, by default, it will be wrong. Okay. So here, see here, a pillow is there. So check like that one. So that is how you will do the answer. Now I am asking you. Okay, I'll ask 1 or 2 persons. 1 or 2 persons. Okay. 1 doctor and 1 nurse. Okay. Dr. Surendra.
Yes, sir.
Yeah, Dr. Surendra. Dr. Surendra. Where are you
Yes,
from,
sir.
Dr. Surendra?
Actually, I am not a doctor, sir. I'm a student.
Okay, you are a student. Okay, fine.
Yeah. Actually, I'm from Philippines.
You are from Philippines.
Yeah.
Okay, fine. So, right. Okay, so, But you are preparing for medicine OET, right?
Yes.
Yeah, that is what I am asking. Okay, fine. Right. Okay, fine. That's very good. So, do you think the points which I am explaining are useful or not? I am taking little time to explain you, but are they useful or not?
Yeah, it's completely useful, sir.
Because we are not going to any other paragraph or any other text. Number one. And even
Yes.
in that part B, we are not reading everything.
Yes.
So, do you think that this is beneficial or not?
Yes, it's complete. It's absolutely beneficial, sir.
So, we are going into three parts. Now, tell me, share your experience, okay, because you are a doctor, share your experience. How far this is beneficial and why is this beneficial? Did you learn this earlier or you are seeing this for the first time, this style of learning? Tell your
Yeah,
own words, frankly speaking, openly, no problem. Even if you say, Simon sir, what you are teaching is nonsense, also it's okay for me.
actually,
Yes.
I started preparing from yesterday itself. First of all, I started seeing your lectures from yesterday itself. What you are teaching is absolutely fine. I didn't go after seeing your lectures. I didn't went for it. I didn't go for anywhere. I'm what you are saying. I'm following what instructions given by you. I'm completely following that. It's very useful for me.
Okay.
I may do mistakes at the beginning, but I'm gonna improve myself.
Okay. Can you give me 3 benefits of following this style?
First is vocabulary. Second is time management. In the beginning, there is a lot of it's not waste of time, but we are doing step-by-step procedure. So if we follow it, if we practice it, at the end, we can save time.
Okay.
And moreover, vocabulary, what you are telling is very nice. I mean, for each and every heading, subheading, it's useful for me to, without going anywhere, without wandering each and every paragraph. I'm gonna completely focus on that paragraph which related to the questions and everything. So it's very useful for me.
Okay, fine. Thank you very much. Now we'll ask one nurse. Okay. Karuna Neharkar.
Yes. Hello.
Yeah, share your experience, what you have learned. You have less time and you have come suddenly and you are learning many things.
Yes, sir.
So, do you think that this is wasting time or learning
No,
little?
sir. It is not at
One
all
minute, one
wasting
minute,
time.
one minute,
Yeah.
1 minute. Doing more tests and in less time, or taking more time and doing less tests and getting good results. Which you do prefer?
I will prefer doing less test, but the like quality learning I will prefer.
So, fine, fine. Now share your experience. Earlier also you prepared and
Yeah.
now you came and this is your first day, second day or first day, I don't remember. Second day.
Second, is,
Okay. And
yeah.
what did you learn? What is the difference in our sessions?
Yeah. Actually, your strategies are straight away pinpointing the answers. Means we are not wasting time. You are improving our vocabulary, and we are confident. If we follow the things, we will be confident while selecting the answer or while writing the answer.
Okay. And the most important part is you are going to confirm the answers.
Yes.
That it is right.
Yeah.
Okay, fine. That's good. Okay. So I'm muting you back. Right. That is it. Now here, let us see how we are coding out. So the answer, yeah, elevate, limb, and the limb is for leg, and this is the epilogue. Yes, that is it. So that is the answer. So there you are going and you are finding the correct answer. That is how you have to identify. Yes. Yeah. That is the answer. So now you have understood the technique now for these questions. I told you 3 steps will be there. Okay, 3 steps will be there. Okay, 1 second, Usha. Before closing it, 1 second. So you understand now what it is, Just let me save it up. Yeah. So that is question number 8. Right. So, yes. Usha, yeah, Usha Thomas.
Yes, sir. Sir, could you please repeat why we need to write a pillow rather than a pillow?
Okay. So there is something called countable. You can count pillows or not count pillows. There are some things which you can count and there are some things which you cannot count. Can you count water? Yes, Usha. Yes, you have asked a very good question. Unmute your phone. This is a very good logical question. Why it is important? Yes. Now I am asking you, can you count water?
No, we cannot count water.
Can you count air? Say only one word. I am giving only one word. Can we count? Yes or no? This is a yes-no question. That means you have to give only one word answer, yes or no. Okay? So, can we count air? Oh, locked again. Don't lock, please. Okay, we are learning a concept. You are a very good, you brought a very good concept. So that's why we are learning concept. So you can unmute. Yeah.
Yes, sir.
Yeah, you have raised a very good question. I really appreciate you because everyone will learn this concept because of you. Okay, you have to be proud, no feeling shy here. Not everyone can ask questions. Okay, questions will be asked by an inquisitive person. Means I want to know why. If you ask the question why, then only you will learn. If you don't ask the question why, you will never learn. So there are things differentiated into 2 types. One is countable and another one is uncountable. For example, okay, you say water. Water you cannot count.
Yes, water we cannot count.
You can only measure.
Yes.
You can measure. And air you cannot count. You can only measure. So those which you cannot count, you can measure. Okay, you can measure how much and how many. So things are divided into groups according to the way how you calculate them or measure them. So one is some things are individual, so you can count them. 1 pen, 2 pen, 3 pens, 4 pens, 5 pens. 1 table, 2 tables, 3. So these are countable ones. And the next one is uncountable. Uncountable.
Okay.
Uncountable nouns. So what are these uncountable nouns? Uncountable nouns means air, water, rice, wheat, pulses. You cannot count them. 1 pulse, 2 pulse, 1 rice, 2 rice, 3 rice. No. 1 water, 2. No, you can. So you cannot. So that is the reason why. So if it is countable noun, you can use it in singular or plural. So that means otherwise it is wrong. A pillow means 1 pillow because you can count it.
Yes.
Pillows more than 1. So that is the rule. But uncountable is by default singular. By default, water, finished. Air, finished. It will not be a or airs, nothing like that. It doesn't have a plural form at all. By default, it is right. But countable ones, you have to say whether it is 1 or more. So it is a pillow or pillows. If you write, okay, a pillow means it is singular. If you write pillows, it means plural.
Yes.
So, if you write pillow, then what is this? Grammatically, it is incorrect. So that is the problem. But in the answer, sometimes they will permit, sometimes they will not permit. So better, why don't we write it? Be careful, no, simple 2 words only, no, 1A, what is there in writing? If you don't write, maybe you will lose a mark. But if you write, you will never lose a mark. Now you understand, because by default, you are right.
Yes.
If you write pillow, you can get a mark or you may lose the mark. It depends on the person who is giving you OET. If it says, okay, give, they will give. If it A is in brackets, you will get a mark. If it is A is not in brackets, you will lose the mark. That's it. Is that clear?
Yes, sir. It's
Okay,
clear.
now you can mute back.
Thank you.
So, concept clear. Say yes or no. Come on, fast. Singular number, plural number. Okay, countable nouns, uncountable nouns. I have taught you many things. Many things I'll teach you when people ask like this. Okay, so 2 concepts I taught you. Countable and uncountable. Singular and plural. And article, a or not. So 3 concepts I taught you. Singular, plural concept, number 1. Countable, uncountable nouns, number 2. Article A or not A, that is another one. So these are the things I have given you. Fine. So that is it. Clear all drawings. Yeah. Fine. Next one. Okay. Next one is question number 9. Question number 9. Okay. I'll teach you many different things. Okay. Every question has a different style. Don't think that all will be same. Okay. Copy. So question number 9. Very good. Thank you, Sanjana. So question number 9. Yes. That is it. Now let us see this question. What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? Now this is the point. Now here, the word, most important word is morphine. Because the question rotates around that. Morphine. What? Morphine. Maximum what? Morphine. Dose what? Morphine. Per kilo what? Morphine. Okay. To patient what? Morphine. Okay. Can be given what? Morphine. Using the intramuscular route, what should be given? Morphine. So everything, it is the central figure, it is the central pillar. If that is lost, everything is lost. Then next one, dose is another word. Okay, intramuscular route is another word. So all these words, but the most important word is, okay, morphine. And morphine is what you know. So this is the key word. Now first step, yes, A, B, C, D, hit the button. Where you will go? Skimming. First step is skimming, then you will go for scanning. I'll teach you scanning. I did not tell you still now. We already did scanning in the previous question. Right. Right. So morphine. Morphine is what? Is it categories? Is it management? Many people say management. It's not management. It is management. See in the dictionary, Cambridge dictionary, it will tell you. Don't believe me. I'm a very ordinary teacher. Don't believe me. Go to Cambridge dictionary and learn. Management, department, month, not meant, month. Okay. Listen to the pronunciation there and the phonetic script there. So this is the point. So question number 9, stage 1 is scanning. Stage 1, scanning stage. Okay. So scanning stage. Now here, in the scanning stage, you have seen that morphine. So, Sanjana, which is the majority vote? Yes, majority C. Once you finish the time, automatically you type like that one. So majority C, that's good. Thank you. So C, that means medication. Now, don't go there again. Immediately don't go there. You are mad or what? Don't go there. Now we have to do scanning. Skimming only for one word. Now scanning. Now what words should you scan for? What? Morphine, you know that medication, it is there. Morphine, it is there. Very good. But what you want? What? Dose. Maximum. So you have to see maximum dose. Maximum dose. And that too IM route. Intramuscular. Intramuscular, I gave a different color. So what is the maximum dose of morphine per kilo? Per kilo he is asking. Per kilo how much? What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular vein route? So these are the words you have to see. The first one is, so here there may be minimum dose, maximum dose. So when there is something like this dosage, there may be three things. One is the minimum. Write down. The minimum dose also may be there. Don't get confused with the minimum dose and don't write minimum dose. If you write minimum dose, you are wrong. Then second one is range. Range means minimum to maximum. So that means 5 to 6. That is the range. If you write 5 to 6, then it is wrong. Okay. What is the maximum you can give? 500 ml, suppose, or mg, suppose. That is maximum. 300 mg is minimum. 300 to 500 mg. So 300 is the minimum. 500 is the maximum. 300 to 500 is the range. Okay. 300 to 500 is the range. If you write 300, it is wrong, that is minimum. If you write 300 to 500, it is wrong because it is the range. Because he is asking only the maximum. Don't be fooled. Because in the answer, there will give you all these three. And he is asking only the maximum. There are many people who write everything. 300 to 500 like that. So don't do that. Okay. And he is asking per kilo how much, not overall after calculating how much is the maximum, he is not asking. Per kilo maximum. So that is he is asking, not maximum amount, what is the maximum dose we can give to an individual? No. Per kilo, what is the maximum of a body's weight? That's important. So there you have to find out. Because I am teaching you some important things. You have to study these things. These are important. Reading between the lines. Reading between the lines is very important. Maximum. And the route is intramuscular route. So you have to go to intramuscular first. Then you have to go to the dosage next. Then there you have to eliminate the minimum so that you will get the maximum. Try to understand that one. Dosage is there. Minimum you eliminate and you will get maximum, like that sometimes. Okay. So this is the second stage. Okay. This is the second stage. Right. Now, so let us go there. Yes, medication. Medication is here, drug therapy protocol. The next one, here. Above 70 patients. So this is the information and this is the table. Now, what I am asking is, here in this question, and here. So here in this question, you can see maximum dose means what will come? Is it a word will come or is it a number that will come? You have to think about that. Maximum dose. Is it a word or a number? Come on, write, hit the button there. Type your answer there. Word or number? Word or number? Write out. You are going to write word or number. I am teaching you techniques. Don't go and find there everything. I don't want to go there directly. Study everything here. So now you have to be ready there. See, capital letters IM will be there, or intramuscular big word with a hyphen will be there. So what are the locators? Intramuscular is a very big word with a hyphen. IM capital letters. Maximum number. Okay, these are the clues. Go search the numbers. Go search the capital letter IM. Go search the big word intramuscular. So these three words, any one you get, that is enough. But numbers may be many. So IM capital letter intramuscular. Okay, go to numbers and see their IM. Or go to IM and see their number. Or go to intramuscular and see their number. Or go to number and see their intramuscular. Anyway, you will get. Go find the numbers and see IM there. Or go to IM and see the number there. It's very easy. Now that technique you apply here. So here you will not get. So here you will get. Suppose. Or here. Or here. Where you will get. Yes. Where you will get. Now C is here. Drug therapy protocol. Drug therapy protocol. Yes, here it is. And here it is. Now where you will find, you know that one. Now there you see root of administration. Root of administration. Okay. And they said adult. Maybe children also, be careful. I'm teaching you many things. That's why time is there. No problem. I'm ready to there. But if you don't have time, that is your problem. You paid fees. I have to give you the best. If you don't have time, that is your problem. I'm taking a master class, it's a workshop. Now there you go and identify things. What you have to identify things. Now I'm going to tell you. What you have to identify is this. Yes. Now numbers are there. Numbers are many. So don't need to go for numbers. So root of administration, you know that. Here is IM and here is SC and here is IV. Okay, that is it. Okay, so that is it. So now, what is that he asked? Now let us see here. This is IM root. This is IM, intramuscular root. So go there and the answer is intramuscular is here. Intramuscular is here. And the numbers of intramuscular is here. Okay. And now, right, let us see here. Now when he says maximum, here is one maximum and here is one maximum. And here is one minimum. So this is minimum to maximum. And this is overall maximum. Complete maximum, final maximum. More than 10 milligrams you cannot give. That is the point. So try to understand this. Once again, I am showing you. This is per kg maximum. And this is overall maximum to a maximum of 10 mg. Okay. This measurement is per kg. Per kg. And this is the ultimate maximum. This is the ultimate maximum. So if it is per kg, it is here. And for kg, this is the range. And this is the minimum. And this is the maximum. Milligrams per kg. So I hope you understand what is overall maximum and range per maximum, range per kg, and beyond kg, maximum. And this here it is minimum 0.1, maximum 0.2 and range is 0.1 to 0.2. Now what you may write? There are some people who write this one. 0.1 to 0.2 milligrams. Sir, should we write kg? Kg is already there in the question. If you don't write also, it's okay. It is already there in the question. Maximum dose of morphine per kg. Per kg is already there. So why do you bother about that which is already in the question? If you don't write also, it's okay. If you write also, it's not a problem. It's redundant. So now, if you write 0.1 to 0.2 mg per kg, many students, they think they'll write, after write, oh, I wrote in the exam very nicely. Nonsense, you wrote the exam correctly. Huh? Cheating himself. So here, how many points are there in this? If you write this full, okay, now root of administration, from there it will go here, okay, and from here it is morphine, okay, Then intramuscular. So that is intramuscular is here. 0.12. If you write this, the answer is wrong. Okay. Then if you write 0.1 and mg per kilo, this is also wrong. You have to write from here to here. That is maximum. This is minimum. 0.1 mg per kilo is the minimum. 0.2 mg per kilo is the maximum. 0.1 to 0.2 per milligrams per kilo is the range. That is per kilo measurement. And overall maximum dosage you can give only 10 mg per adult. If you give 10.1 mg, then it becomes poison, maybe. Dangerous, not advised. So that's it. Maximum. Beyond this one, you cannot give. This after a certain extent, this is final. That's all. After this, nothing more. How many kilos added? No problem. This is the maximum. So that's it. So this is the answer. This is the answer. So you should know what is maximum, what is minimum, what is range. That is English. That is English. Not just writing whatever you want and saying, I wrote 4 times. That means that shows how clever you are, how intelligent you are, how wise you are. Okay, that's it. That only shows. Nobody needs to tell. That is a proof that you are very clever, extraordinary person, because you are not clearing OET even after 4 times. Okay, that means you are undestroyable. That much wisdom. Okay, fine. So what I'm telling you is learn. That is what they are making you to understand. By mistake, if you give wrong dosage to the patient, if you don't understand this, you'll make some person miserable. You'll make some person helpless. Okay, you don't understand what is maximum and minimum. Then how can you calculate the dosage and give to the candidate, patient? Are you fit to be a nurse in a English speaking country to understand all these things and give the proper treatment? That's what it is. So that is the concept. That is the concept. So the answer is here. Right, 0.2 mg per kg. Yes. Sanjana, type there, concept clear? And everyone will write yes or no. Just for my satisfaction. If anybody doesn't write, that's very good. Yeah. Date. Okay. So that's it. Learn, find out. Okay. Right. Thank you. Right. Okay. This is how you have to go now. The same techniques you have to apply for every question. Right. Next. Next one. Question number 10. Question number 10. Okay. Yeah. Right. Copy. Yes. Now, you know where this is exactly now. Yes. So that's it. Question number 10. Which parts of a limb may need extra padding? Limb. Padding. So what is happening there? You are giving extra padding. Padding means a support. So to support, padding, to provide padding, providing padding or to provide padding. So which part of the limb may need extra padding? Extra padding. So provide, to provide extra padding. Which parts of a limb? Which parts of a limb may need extra padding? Limb. So which parts? Which parts of a limb may need extra padding? Extra padding for which part of the limb? So that is it. So extra padding. So now you have to think about this one. I'm going to ask you the question here. So padding, that means you are giving padding, extra support, so that something may not go wrong. So where it will be? Is it in categories? Extra padding means extraordinary, not ordinary padding, extra padding. That means not simple, not simple thing. So think like that. Extra means not ordinary. So do you find this one in categories? Do you find in management simple? Do you find in medication, drugs? Do you find in backslash? So the word extra padding because of extra problem, because of nature of seriousness. Is it simple or extra? So that is how you have to see. Now hope you have got an idea now. Think. I'm making you think. I'm not giving you, asking you test. I'm not giving you answers. I'm not giving you answers at all. I'm making you think. That's all. Whether it's right answer or wrong answer, there's none of my problem. Direction, if I'm putting you into the correct flight, so you'll reach the correct destination. That's what I'm doing. So here, yes, you have to type, keep A, B, C, D ready. So 5, 4, 3, 2, 1, and submit. Submit your answer there. Okay. Right. So now, yes, Sanjana. Yes, majority D. Okay, fine. Thank you. So we'll go for D. There go and see the word padding. Padding. So go to that area and see the word padding. And there you see limb. Okay. There you see limb. Sorry. And there you see part. And the name of that part, which part, that part will be given. Okay. So So now here we are going to scanning now. Skimming is done. Skimming already we have done. Which part, what is the heading, what are the subheadings? Already there at the bottom. Heading and subheading. So after this, we'll take a break for dinner. Okay. We'll take a break for dinner and we'll join at 11. Writing class will be postponed. Okay. Writing class will be postponed. No problem. I will take it. Definitely I'll take it. Okay. So now, which parts of a limb may need extra padding? So we'll go to text D and there we'll see. So this is padding. Padding is regarding, serious problem. And serious problem means backslap, fracture, serious fracture. Okay, to further damage, break further damage, extra padding is needed. Okay, so that it will touch anywhere also, it will not hurt like that. So we have to go there. Print a screen. Oh, okay, fine, no worries. Yeah. So now there you will go and find. Yes, backslap. Now you identify here very clearly. I am taking you to the question. Okay. Now here you see, right? Extra padding where it will be. So extra padding, right? Extra padding where you can find, see, you can just see extra padding where you can find. So that word you have to go. Extra padding is there. Okay. Which part of the limb? Limb only, this one is totally for arm and legs. We know that these are for limbs only. We know that. Okay. We know that extra padding is there. So now you can see here, extra padding is here in this sentence. So this is a full stop. So no need to go before. Eliminate that part. All others are eliminated. Just to search for the word padding. That's all. Just for the word padding. Okay. Right. Fine. So here also is padding is there. This is normal padding. But here is extra padding. So can be placed where, which part of the body? So now, okay, if necessary, I don't know, the question is there in front of you. The answer is there in front of you. Okay, I'm not mad to give you the answer. So find out, I'll take you to that place. Fine. You know where it is. Extra padding is easy to find out. That's not very difficult because we have saved a lot of time there. Why extra is there in the end? Why we went to, do you know? Can anybody tell me? Can anybody tell me why extra is there in the last? Can anybody tell? Can anybody tell why? Why in the 7th point? I want. Why? Ordinary will be in the beginning. Ordinary will be in the beginning. First one will be ordinary, then only extraordinary. Okay, see, ordinary students stay only till some time. Extraordinary students will stay till the end. Now you understand, I think, what common sense I have given you. Known to unknown. Okay, I'm asking you, Uppula. You can unmute. Yes, Uppula. Now see here, ordinary students were there till 15 minutes back. Ordinary students were there till 15 minutes back. But extraordinary students only will be there for the next 10-15 minutes. Do you agree, Uppula?
Yes, sir. Definitely, sir.
Because they know that the essence is coming, the quintessence is coming, the extraordinary quality is coming. They know its value. They know that this they will not get again. They know not Simon sir will not stay behind the computer another time like this. Maybe he will come or not. Maybe that time I will be available or not. So something is very extraordinary. Extra information is he is giving. So I got all the ordinary informations and I am an ordinary student. I will go after ordinary staying for ordinary 1 hour. Extraordinary students stay till the extraordinary information, they can get everything. They will take extraordinary length of time. They will have extraordinary patience. So ordinary things will be only to an extent in the beginning. Only extraordinary people will get extraordinary marks. A grade. Ordinary students will get ordinary marks, C+. Wow, what an explanation. I think you understand now what is the difference between ordinary and extraordinary. Known to unknown. So extraordinary things you have to see only in the last. Okay, emergencies you have to see in the beginning. Extraordinary things. Emergency is also extraordinary. Sometimes it goes to the end also. Right. Regina. Regina Sudesh. Do you understand the logic which I gave you now? Or Ajay Kumar? You may be thinking why I went to the last part. Extra will be 80 to 100% only is extraordinary. So extra. So here you can see first half, second half. So now you see extraordinary means extraordinary quality. What do you mean by extraordinary quality? This is 25% failures. This is 50%. Okay. Failures. This is 75% pass. This is extraordinary. So last 25%. Yes. Okay. Yes. You have to understand here. Okay. You have to understand here. Right? You have to find out these things. These are the poorest. These are the moderate. These are the better. These are the best. So extraordinary is the last 2 points. So that is how I gauged it. So you can find out like that. Reading between the lines. Now write the answer, please. And when I say post, post. So 7, 6, 5, 4, 3, 2, 1 and submit. He asked, what is the question? Which parts require? He did not ask where. So no need of over. He asked only noun. So why are you using preposition? Which parts? Over is not a body part, my dear. So by default it is wrong. Those whoever wrote over, the answer is wrong. You think that you will get the mark there? He did not ask where. He did not ask where. He asked which parts of the body, which parts of a limb, He did not ask where. Where means over. Over is not required. Names of the parts. Which parts means names of the parts. That is enough. So that is what you have to be very careful. You think that you will get the answer, but still you will not get the answer. That is OET. Okay. That is OET. So we have seen 3 answers now. Now these 3 answers we will check. Okay. So you can find the rest 4 answers. Okay. And the multiple choice. Try your level best. Okay. Answers. Yeah. 8th answer. You are written. 7th answer you are written. Now let us see the 8th answer. Okay. 8th answer is, sorry. 8th answer, yeah. Eighth. Okay, 8th answer is both are correct. See, a pillow or pillows. You can write singular or plural. Now I think you can understand why I am telling you. If you write a pillow, it is definitely correct. If you write pillows, you can definitely get the mark. But if you write pillow only, maybe you are right, maybe you are wrong. If he gives bracket, now you are saved. Because he put it in the bracket, means not compulsory. You are saved. Yeah. Now Sanjana, type there. 8. If right or if wrong into. Come on first. If right or if wrong into. Yes. After she puts 8, then you can write. Fine. Next question is, yeah, this one. Yes. Next question is this one. What is the maximum dose? And the answer is 0.2 mg per kg. If you don't write kg, it's okay. Write down 9, Sanjana. Okay. Right. That's it. 0 to 2. Actually, it is 0.1 to 0.2. So if you had written 0.1, it would have been wrong answer. If you don't write kg also, it's okay. I told you. But if you write kg also, they will accept, because there are many people who don't understand what is this question. They just write something. They don't, even if you don't write, it is correct. Actually, if you don't write kg only, it is correct. Per kg, how much? That's what is it. No need to raise per kg again. Okay. So that's it. So next 10th question, Sanjana. So 10th question is here. Which parts of a limb may need extra padding? So type your answer, please. Then, no, you already typed, no? I'll show you the answer. So bony prominences. If it is right, put R. If it is wrong, put into. Okay. Now, total score out of 3. Total score out of 3 questions. Yes. Hit your button. Hit your button. Come on, fast. Come on, fast. Yes. So now, next question is total score out of 10. Previous and now. Total add. So those who have, if you have written only 3 answers, then write 3 answers only. Some people who have joined only for this session, okay, they can write, they can leave it because already you have written. It's okay. So that is the difference. Very good. Yes. Provide your feedback. Yes, I think I am exhausted today. So provide your feedback. How was the session? What did you learn? What new concepts you learned? Okay, whatever you want to write, you can write in 1 minute. Okay. In 1 minute, you can write 1 or 2 sentences. Yes. Feel free to write so that others will. Okay. Whatever you have learned or anything you can write so that others will. So I think we'll call it a day. We will call it a day. Right. Okay, 30 seconds more. I'm disconnecting after that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and submit. So good night. Calling it a day. See you. Those who don't understand calling it a day, for them, see you tomorrow. Calling it a day is an idiom. Okay. So all of you who have written letters, they will be corrected tomorrow morning. So remind me. Okay. So write your letters and submit me. And submit your reports, all of you, whatever you have got, marks. I'll send it in the group report. How the report will be there, I will send that one. So the report will be like this. Submit your report. Submit your report. Report will be there. Many places reports will be there. So when I say submit your report, okay. Yes, here it is. Submit your reports. All reports will be there. Okay. Submit your daily reports. Yeah. Here it is. See here how reports will be there. Like this. Like this. Like this. Okay. I will send you this style. Okay. I'll send you this style personally in the WhatsApp. Okay. Or you can create your own style. Okay. You can create your own style. Okay. Like this. So who will make nicely like this? It's already there somewhere, but I have to check it. Okay, I will send it to you. I'll send it to you. I'll send it to you. No worry. Okay, then. No, now no writing class. I'm sorry. I'm tired. Tomorrow. 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 I'll message you. I'll message you. Maybe 9 o'clock or maybe 11 o'clock or 12 o'clock. Writing class. Okay, remind me tomorrow. Jaslina. Okay, select all, copy, close, paste.